And so you've worked in, various different sectors: healthcare, justice, social services, financial services, real estate. What do you enjoy now about working in healthcare, especially during this time? The past year, I don't think anyone could have predicted what it was like. So what do you enjoy about it and about your role as a CEO at Trillium Health Partners?
Thank you for acknowledging the year. And I always want to acknowledge the just hundreds of thousands of men and women who have, really been in the service of others and saved lives and protected people. Everything from our firefighters, our paramedics, our healthcare workers, our primary caregivers, our caregivers in the home, in long-term care. These are heroes in so many ways. Healthcare is not a natural place that I came to, but I found that it's been a natural fit. You talked about my background, and when you think about a pandemic, dissect what's happening right now. You're having to work at so many multiple levels of decision making. You have to deliver things, a service called healthcare. You're having to work in a system, vaccinations, assessment centers, hospital care, long-term care. Like, this system is having to work together in a way it hasn't been before. You're having to deal with issues in crisis, and you're having to, the physical plant of the building, we've learned in this crisis matters, like the physicality of a building. If you're a new building, you had less outbreaks. If you're an older building, you probably had more. And learning about the mechanics of the building and how that impacts. So, and then of course, people, it's always about people. So when I look at my background, it's like every piece of my jobs I've had to draw upon. When I think about working at Brookfield, in my 5th month at Brookfield, the best asset management company in Canada, 9/11 happened in the United States. Brookfield was one of those companies in the downtown core of Manhattan that had to help, deal with the early days of what had occurred and then rebuild. And so, when I think of those towers going down in Brookfield, our CEO at Brookfield got in a car and drove 24 hours to get to downtown Manhattan to be on the front line to help people. And so when I think about the CEO of a hospital during COVID, I know where I need to be. I need to be talking to our staff. I need to be figuring out what they need me to solve for them. When I think about my work in government, I had to work with so many different stakeholders at all levels. I'm drawing upon that. When I think about my work in lotteries think about where lottery tickets are in small communities, in local stores, etc. It's community. I've drawn on the community side. So, I never thought in a million years that my kind of crazy career path in this moment would be so valuable to being a CEO in healthcare. And then just to end by saying, what draws you to healthcare? If you want to be somebody to make impact in making people's lives better, or when they are their most vulnerable, holding their hand through a journey, you couldn't have a better job.
I totally agree. And it's like all your previous roles prepared you for this role. And Michelle, how are you managing your own health? How are you taking care of your own well-being? Because, there's a lot of attention on our frontline health workers, but there hasn't been as much attention towards our leaders, like who are working behind the scenes, many of them, 24/7.
Well, you know what? Thank you also for acknowledging that. We have about 300 leaders at Trillium Health Partners, medical leaders and non-medical leaders. And I can tell you these people have had barely 2 days in a row off at any time during this pandemic. We are trying to cycle people out for sure, but it's hard. And like everybody, I need my hair cut and all those kinds of things. But truthfully, what we've done is, number one, tried to stick together so that we're all sharing a load, no one person. We are trying to have cycles of people to rest them and things like that. We have all sorts of resiliency tools that we've used. There was one moment where I actually took our leaders through a resiliency assessment. I was doing my own self-assessment in front of them so that I could model how we needed to check in with each other. And so, I do believe this is something that any leader needs to pay attention to personally and professionally. And I would say, as we are having this conversation, we are now in wave 3. It's even more important now, and to do it more often. And from my perspective as the CEO, prior to COVID, I said to everybody, the CEO never gets to not be the CEO. It's a 24/7 job all the time. And that has been especially true during COVID. And so I'm having to be very mindful as well. There have been times during this period where I've said to the team that works closest with me, I cannot take time off. I'm not going to get the weekend off. I haven't had weekends off. That's not something we've been able to count on 2 days, right? And I'm tired. And I've said, I need you to watch my decision making. If you think I'm moving in the wrong direction, you got to stop me. We're moving fast. Pay attention, because I'm feeling more tired than I usually do. And so you ask for help. It's a bit nicer out, as we know, and I'm making mental note, I just got to get outside. I'm today at home doing this interview. I'm mostly in my office till late at night and early in the morning. So, I never know what kind of day it is out there. And I'm trying to make a mental note to get out and get some fresh air. I've had, like everybody, starts and stops around physical exercise. But mostly, I would say I am acknowledging personally that I no longer have 3 phases of a day where it's work, sleep, and personal time. It really is about working and sleeping to make sure that I am getting rest when I can. If I have a morning where it doesn't look like I have to be in at 5 in the morning or 6 in the morning, take a little time in the morning and don't feel guilty about it. It's those kinds of things, but it's hard. And I just want to acknowledge for everybody, it's hard. I had one colleague who said to me, Michelle, isn't it true that we're now measuring our personal time as if I could get 5 hours of uninterrupted time, that is a successful day. In 24 hours, if I could just have 5 hours with no calls about work, that's a successful day. And mostly that's sleeping, right? So I just, it's hard, and we've got to keep pushing through. And the way to push through is to make sure others are with you and supporting you and having your back and telling you when you're too tired, don't make a decision, and telling you when you're too tired, you need to go home. And so giving your teams permission as a leader to do that is important.
Yeah, and it's harder when everyone else is tired as well at the same time. Yeah. And are you feeling the fatigue now? How long can we sustain this way?
Yeah. I personally, I would say I'm not feeling that overwhelming fatigue at this moment. Doesn't mean there haven't been. I'll tell you what I'm more worried about right now is the emotional fatigue of illness. I rounded the last few days and I've been talking to staff, and one of the things I'm hearing more about is our staff are really tired, which is natural. It's been just a journey, right? But with the wave 3, we're seeing younger people. We're seeing you and me, right? And that's not to say that when it was older people, it was okay, but there's something about that individual that you identify with sitting in a hospital bed, fighting for their life. And we're seeing more of this. And I think that emotional fatigue is going to start to set in a way that it hasn't. Right. And, my father passed away this past year. And
I'm sorry to hear that.
And it was unexpected, not from COVID, but, my father was 86 years old. He had a long, wonderful life. And while I am sad he passed away, there is comfort in somebody having a long and wonderful life, right? And now we're hearing about younger people dying, younger people being more chronically ill. And so these are things that I'm thinking about now. And this is what I'm worried about for our staff and for our leaders, the emotional toll of just the illness and the burden of illness that they're treating. It is relentless. And I don't have a magical answer about what we're going to do, but I just know this is part of when you use the word fatigue and the impacts of COVID on the healthcare system, it was first the physical nature of it, PPE, hot, sweaty, and then it was the personal impact. I'm managing my children, my parents while I'm working hard, and now I think it's going to be the emotional impact. So I'm very mindful of this. Our team's mindful of it, and this is where we have to make sure we have a lot of conversation. I just want to give the RNAO a big shout out. They're doing some wonderful work in this area for our nurses, and our OMA and our medical associations are doing some really good work in this area as well.
Right. That's so great. What other supports do you think we might need to put in place?
Well, for me, I start to turn my attention to the medium and longer term, and we all talk about mental health supports, but let's not forget what the mental health supports have to be wrapped in. We need effective housing. People need to have jobs, food security.
Right.
And so for me, it's the things we used to talk about before COVID on creating a really inclusive society where everybody could participate. We need to really double down on it. There are more people going to food banks than ever before. If we don't think that affects somebody's self-esteem, mental health, why are they going to food banks? Because they're out of work, or their job is not sustainable for the housing prices that we have now. We are going to have to figure these things out.
Right. Really the social determinants of health, as they say. Yeah. And that brings me to the aspect where all our attention was always focused on hospitals and acute care, rather than, the community and all the other settings that are part of people's lives. What is your opinion of that?
Well, you know what? There is no health without social determinants being dealt with. The vast majority of the most difficult issues we deal with are individuals at all stages of life that have some form of a gap in those social determinants. If they're unemployed, that leads to poor health. If they have a mental health issue, that disrupts their ability sometimes for stable work environments, stable housing environments, etc. That leads to poor health beyond just mental health. It leads to poor physical health or medical psychiatry issues. If you have bad food security in a community, we think of our Indigenous populations and just simple clean water. And so these are the things that we have to understand. Hospital care is at the end of the process. When everything else fails and somebody either gets a disease or is compromised in some way, then acute care should kick in. It shouldn't be the first. It should be the safety net that people need when all other things fail.
Right. And what do you think our government or we need to do as a society, a community, to help this cause?
Well, I have to say, and I've worked for all levels of government. I've worked for all parties in government. And so when I make this statement, it is not a partisan statement at all. But I am pleased to see the attention in our most recent budget to not immediately balancing and understanding that it may take us a decade to get out of this. And so, when I see that, I see a government saying there's no quick fix, and if you look at, there's a massive investment in healthcare, long-term care. We've put more money into education, more needs to be there. And the attention to skills development, and what we need to do to create skilled workforces so they can be self-sustainable as individuals. So for me, I think government needs to have an ability to look at these problems on a multidimensional level, and they have to understand they can't be solved overnight, and certainly not in a 4-year mandate. Right. And I think this government is at least I haven't had an opportunity to see much more than the public has around the first week since our budget was announced here provincially, but I certainly see good building blocks to go forward for the various sectors that will need support.